So today we are going to finish up chapter 1, and we're going to talk about how we can describe different parts of the body. So we're going to talk about body sections or planes, and then we're going to talk about the regions and quadrants of the abdomen, and then we are going to talk about the different regions of the body. So a lot of terminology in this one. So when we're talking sections, we are talking about how to cut the body. And just to be super gruesome, I'm going to use my bone saw to show you how you would cut. So sagittal or median divides the body into left and right. So if I took my saw and cut this way, I would have left and right sections. And by the way, I know that those were opposite, but it's fine. So we would have right and left sections if I cut this way. So that's sagittal or median. And I use sagittal the most often in this case. Now, sagittal doesn't have to be right down the middle. As long as I get left and right sides, it's sagittal. Directly down the middle is considered mid-sagittal, so perfect, even left and right sides. The next way to cut is transverse or horizontal. So now I would hold my knife this way and go this, giving me top and bottom sections. So it divides into superior and inferior sections. The last one we're going to talk about is coronal or frontal. So coronal or frontal, I would actually slice this way, giving a front section and a back section, an anterior and a posterior section. So I tend to use the word sagittal, I tend to use transverse, and I tend to use coronal or frontal. I go back and forth on those. And that's just the body sections or planes. You'll hear me use them a lot. So check out, give yourself a practice run. Now here is a body that has been sectioned in all the different directions. So this one has cut straight down the nose, giving a right and left side. You're currently looking at the left side right here. So this would be sagittal, specifically mid-sagittal because it is right down the center. This one cuts right through the abdomen, straight across, giving you top and bottom. And we are looking at the bottom section, so we are looking at the inferior section. And then coronal or frontal goes right through the body, giving a front and back. Here we're looking at the knee, and you don't see a patella, so this is going to be the posterior view, the back view. Here is the same thing with the brain. Again, left and right, transverse section. Superior and inferior is going to be, left and right is going to be sagittal sections. Can't believe I just said that. Superior and inferior is transverse sections, and then front and back, anterior and posterior, is going to be the coronal. Now, the abdomen. The abdomen is a ginormous region. And if you go to the doctor and say, "Doctor, my tummy or my belly hurts," that can mean a lot of things. So they're going to pay attention to where you touch. They're going to look at the areas. And we can divide them in two different ways. We can do the regions, which is like a tic-tac-toe board, or we can do quadrants, which is just a plus sign. So regions first. So if I take everything from the diaphragm, that's this muscle right here, down in the abdominal pelvic cavity, remember that from one of the last videos, and draw 2 lines down and 2 lines across to make a hashtag across the body. Now picture those. We will have it, remember, anatomical position where they're facing you, eyes forward, hands down. So if you're looking at the person, this is the right, and this is the left. That would be, when I'm sitting here the same, it's the same, right, left, we're happy. But if I look at her, and we want to both do right hands, I have to cross the body. So remember that when we're discussing this, we are going to be discussing on the person. So we name these based on what they're kind of close to and if they're right or left. So everything on this side is right side, everything on this side is left side. The first 2 top side regions are going to be the hypochondriac. And hypochondriac means below cartilage, and specifically below cartilage of the ribs. So right here is the right hypochondriac. Right here is the left hypochondriac. The upper center square right here is going to be just at the stomach. So it is the epigastric, above stomach region. Right here, center square is, or up center square is epigastric. Now if we go to the middle column, or row, sorry, they are close to the lumbar vertebrae on your back. If I turn this around, you'd see the lumbar vertebrae. So this is the right lumbar region. This is the left lumbar region. And the very center square, if I'm playing tic-tac-toe, is the umbilical region. It's right where the belly button is, umbilical region. Then the hips are right here, and the hip bones that flare out that you feel right here are your iliac bones. So this is the right iliac region. This is the left iliac region. And then the center of that is going to be the hypogastric region, below stomach region. So hypogastric, umbilical, epigastric. Right hypochondriac, left hypochondriac, right lumbar, right iliac, left iliac. I know those are some terms that are harder to understand, but they all do make sense if you know what they're referring to. Quadrants are going to be more commonly used, and they are extremely easy. Make a plus sign across the abdomen. This is, and these are hard to understand, right? Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. So if they were going to describe where the stomach is, and the stomach has fallen out of this guy, but the stomach would be right here, it would be in the left upper quadrant. It would also be part of the left hypochondriac region and the epigastric region, but it would not be in the right epigastric or right hypochondriac region. So there are the quadrants and the regions of the abdomen. So now I'm going to use some terms and how they describe. So if you see the word abdominal, it's going to refer to the stomach. If you see acromial refers to edge of shoulder, acromial. Antebrachial refers to forearm. Antebrachial, from elbow to wrist, antebrachial. Antecubital refers to front of arm, very specifically, because remember the anatomical position is hands forward. The antecubital is where they're going to draw your blood, right here in front of the elbow, the front part of your elbow. Axillary refers to armpit. Brachial refers to the upper arm, where your humerus is. So antebrachial, lower arm, brachial, upper arm. Antebrachial, brachial. Buccal refers to your cheeks. Carpal refers to your wrist. Right here, those are your carpals. Celiac refers to the abdomen, specifically the organs, the intestines. So celiac is abdomen. Cephalic refers to head. Cervical refers to neck. Now, cervical can also refer to the cervix in a female, but in this class, we're going to refer to the vertebrae way more often. So if you hear cervical, think neck. Costal refers to the ribs. Your costal cartilages are the cartilage that attach to the ribs, and the ribs are these little lines right here. They would go out and cover this, but they're cut away for this vision. So costal refers to ribs. So if you were to look for, you're going to listen to somebody's heart with a stethoscope, you want the fifth intercostal space. So what you do is you find the between costal rib space. So here's 1 intercostal space, 2 intercostal space, 3 intercostal space, 4 intercostal space, 5 intercostal space, 5 intercostal space, that's where I want. This is where you're going to put the bell of your stethoscope to listen to the heart, but a little on the left side, not the right side. Coxal refers to hip or tailbone. So, Coccyx, coxal. It's going to be this region right here at the end, your butt bone, where you would sit on. So that's your coxal region. Crural refers to front of your leg, your shin. So your shin is the crural region. Cubital refers to back of elbow. So this was antecubital, this is cubital. Antecubital, cubital. Antecubital, cubital. Digital refers to your fingers and your toes, the digits. Dorsal refers to the entire backside. So remember when we talked cavities, the dorsal cavity was on the back side. It had contained the brain and the spinal cord. Femoral refers to your upper leg bone, the thigh. So femoral is your thigh. Frontal refers to your forehead. So if you say something stupid, you're hitting yourself in the frontal bone. Frontal. Genital refers to the area with the reproductive organ. So it's going to be in this region right here. There's more. Gluteal refers to buttocks. This is not a new term, so I'm sure you know it. It refers to the buttocks. Inguinal refers to the groin. So the groin, where their leg meets your abdomen here, this is inguinal. And you may have noticed when you're getting a physical, the doctor may check here. What he's checking for, she's checking for, is hernia, inguinal hernia. So this is where they're looking for. So if they're feeling they're really just feeling to see if any of the intestines here have poked through the muscles, and you can see that here. That's an inguinal hernia. Lumbar refers to low back. So this is the lumbar region, and that's why we named the regions on the stomach lumbar, because they're close to this part of the body, the small of your back. Mammary refers to breast, the mammary glands. Mental refers to chin. Most of my ways of remembering these end up being a little bit violent, but I always remember if somebody is being crazy or mental, you want to punch them in the chin. I really don't punch people, I swear. I just need to tell you these. Nasal refers to the nose. Occipital refers to the back of the head. So if somebody's being super stupid and you want to whack them on the back side of the head, you're whacking them in the occipital. I told you. I don't know why, but I always remember these with some violence. Oral refers to mouth. Orbital refers to eye. Otic refers to ear. Tarsal refers to your ankle. Umbilical refers to your belly button. Vertebral refers to your vertebral column, your spinal column, so all the way down. Palmar refers to your palm. That makes sense, right? Palmar. Patellar refers to your kneecap, the front of your knee. Pectoral refers to the chest region, right here. Pedal refers to the foot. In other words, you pedal with your pedal region, your foot. Pelvic refers to the pelvis. So you're going to be looking at the pelvic bones, lower here, pelvic. Perineal is the area between the anus and the external reproductive organs, so the penis or the vagina. The perineal is that area of skin there. If you know anybody who's a CNA, you would have to perform peri-care. Peri-care is short for perineal care, where you are literally wiping butts. You're cleaning the bottom of a person. Plantar refers to the sole of your foot, the bottom of your foot. So if you know anybody who's gotten plantar fasciitis, what that is the fascia, the stuff that holds your foot bones of your foot together. Sorry, guys. That hold that together, they actually start kind of tugging on the bones and causing pain, and that's what plantar fasciitis is. They're at the bottom of your foot. Popliteal refers to the back of the knee. So remember the front of the knee is your kneecap. The back of the knee is the popliteal or patellar for the front of the knee. The popliteal, I always remember this because if somebody makes you mad, you want to pop them in the back of the knee. Popliteal. Okay, again, I'm not violent. Sacral is going to be above coxal. So coxal was here, sacral is here. It's just in this hip region just above where your sacrum is. Sternal refers to where your sternum is here, center. And the last one is sural. That is your calf, your lower back part of your leg. So remember, the crural was your shin, and sural is your calf. Crural front, sural back. I know those are hard. Those are weird to think of. So those are terms that I'm going to say at some point in time, and knowing what these mean are going to help you a lot. Here's a picture of all those things. Make sure you look over it closely.